Yeah, I believe we can start now, Doctor.
Okay. So today we would like to talk about kidney diseases, things that harms our kidneys or things that brings about kidney diseases. I wouldn't want to spend a lot of time because when I do so, it becomes boring. So I would love to use 1 hour, about 40 to 45 minutes for the lecture, then the other 15 to 20 minutes for questions. I would love a lot of people to ask questions so that anything that is bothering all of us, we can all learn. Now, when we talk about our kidneys, the kidney is a bean-shaped organ. There are two that is located below our ribs. So anyone who is watching this video, just put your hand at your navel, your umbilicus. Then you trace it to your back. That is where your kidneys are. They are directly below your rib cage. They are two bean-shaped organs. I am not well versed in Zoom, but I will try and be projecting some videos and pictures. So if there is any problem about the sound or the picture or the video, please prompt me as soon as possible. I don't know much about the Zoom, so I would love to be projecting certain things. So this is how a kidney looks like. A lot of people have heard kidney, but maybe they've not seen how the kidney looks like. So this is how a kidney looks like. This is a normal kidney. Please, can everyone see what I've projected, please?
Yes.
Okay, everyone can see what I've projected.
Good, correct.
Yes. So this is not a toy kidney or animated kidney. This is a natural kidney from a dead patient. This is how the kidney looks like. Okay. Now, what are some of the functions of the kidney? The kidney has a lot of functions. And if you can hear me clearly, yes. The kidney filters the human blood. The blood has a lot of components. The water part of the blood is called plasma. Then there are other sediments in the blood, the white blood cells, the platelets, the red blood cells, and other micronutrients. But the kidney filters every 1 minute. The kidney filters half cup of the human blood. So to sum it up, the kidney filters the entire blood 60 times within 24 hours. I repeat, within 24 hours, the kidney filters the entire human blood 60 times within the 24 hours. Now, what are some of the functions of the kidneys as I've earlier on started? It is responsible for filtration and excretion. We're taking a lot of food, we're taking a lot of water, as I have my glass of water here, and I've sipped small. The kidney filters the water we drink and the food we eat. After digestion, it forms into a semi-liquid substance, which is medically known as a chyme. So when it gets to the kidneys, it filters it, then it removes all the toxins that are unwanted by the body, such as uric acid, such as ammonia, such as magnesium, phosphate, calcium oxalate, urea, and the greatest dirt in the kidney, which is creatinine. That is one function of the kidney. Another function of the kidney is the controlling of the body's pH. When we talk about the body's pH, it is how acidic or basic the body is. That is why we always say that the human body has some hydrochloric acid in our stomach. So we shouldn't also be adding a lot of acid, such as citruses like oranges, tangerines, pineapples, and the likes, because the body already has hydrochloric acid, which is deposited in our stomach, and it has its own peculiar function, but that is not what we will be discussing today. So it is the function of the kidney to make sure that it controls the pH of the body or the blood. That is, it wouldn't let it be more acidic, because when it is more acidic, that is what causes a lot of ulcer, stomach ulcer, duodenal ulcer, and other ulcers. And it shouldn't also be basic. When there is too much base in the body, it gives way for a lot of bacteria to thrive, because they can't live in an acidic environment. And therefore, when the body is full of base, a lot of bacteria, microorganisms can thrive in the body. So it is the function of the kidney to make sure that the body isn't too much acidic nor too much base. Another function of the kidney is to promote an active form of vitamin D. We know vitamin D is essential for bone strength. So the kidney makes sure that it promotes an active form of vitamin D that helps in giving us a very strong bones. The kidney also controls fluid balance. There will be a time you will be urinating a lot. The kidney has to sense that, no, as the person is urinating a lot, the kidney has to suppress the amount of water you'll be excreting, either through urination, either through sweating, either through vomiting, so that you wouldn't lose a lot of water or fluid to become dehydrated. So that is another function of the kidney. Now, another function of the kidney is the production of erythropoietin. Erythropoietin is basically an enzyme that is stimulated by the kidney, and it helps the bone marrows. When you are chewing bone, you could see there is a brownish substance within the bones. The erythropoietin stimulates those bone marrows to produce the reddish part of the blood. That is the red blood cells. So that is another function of the kidneys. And finally, it also excretes or removes drugs when we take in from our body through glomerular filtration. So these are basically the functions of the kidneys. Now, lest I forget, the kidney has a filtrating point. So I'll basically say the kidney is like a colander, in what we call sonye, a colander or a schema. That is how the kidney is. It has a filtrating point, which is called nephron. And each nephron is like a pipe that is connected with a lot of blood vessels, which is also called glomeruli. And these filters every water that gets into the kidney. The heart is like a polytank. In Ghana, I don't know if that is how it is in abroad. In Ghana, when you would want to get your own water supply, you dig a borehole, then you place a machine in it, then you connect pipes so that the machine can drain the water, then it gets to a polytank. So the heart is like a polytank. Now, before the water can get to the polytank, there are a lot of filters that are connected. So as the water is drained from the well, before it gets to the polytank, it makes sure it passes through a lot of filters. So the filter can be related in proportion to the kidneys. So the kidney filters the water before it gets to the heart. The kidney filters the blood before it gets to heart, so that the heart can also pump the blood to various organs of the body. So just imagine, if the kidney is unable to function properly, that is the filtrating point, what do you think will happen? It will definitely push all the blood that is concentrated with a lot of toxins to the heart, which will affect the heart. And not only that, the heart will also pump all these toxins to the parts of the body so that the organs will be affected. So let's start with the pains that really affect the kidneys. One is diabetes. Anybody who has diabetes is liable of having a kidney problem. Why do I say so? Diabetes basically means high blood sugar. When you measure your sugar level and it's more than 10, 11, 12, 13, 14 millimoles for a longer time or consistently, that is when we can say you have hyperglycemia. that has led to diabetes. When you have diabetes, it means your pancreas is unable to curb the glucose level in your blood, and therefore these sugars that is high in your blood will clog in your arteries and veins. They are like pipes. So just imagine if you have a pipe and there is something that has clogged in these pipes, what do you think will happen? It will make sure that water can't flow through the pipes. That is exactly what happens when you have diabetes. When the sugars clog in your veins and arteries, it makes it very difficult for blood to pass through your arteries and veins. And when all these sugars get to your kidneys, the kidney is supposed to filter blood and not blood filled with sugar. So it destroys the kidney's filtrating point, which is the nephrons and glomerulus. So anybody who has diabetes, please make sure you work on it so that your sugar level can subside. Another thing that also affects the kidney is hypertension, high blood pressure. When we talk about hypertension, when you measure your blood pressure and it is more than 120/80 millimeters of mercury consistently and persistently, that is when we say you have hypertension, high blood pressure. When you have high blood pressure, this is what the kidney does, and this is how it affects the kidneys. The kidney produces a hormone that is called renin, and this renin converts something which is called angiotensin 1 to angiotensin 2. And that will stimulate something in the kidneys, which is called aldosterone, to make sure that there is a restriction in water. So as you have high blood pressure, it means that your heart is pumping a lot. The pumping action of your heart has subsided its normal pumping activity. And therefore, this heart, which is pumping a lot, will push a lot of water to your kidneys, because as the kidneys filters the blood, it also needs a lot of blood to work on itself. So the heart will also pump a lot of water, which is part of the blood, to your kidneys. And the kidneys will make sure it retains this kind of water. That is what causes edema. People becomes swollen. So anybody who also has hypertension, please, let's make sure we work on our blood pressure so that it wouldn't affect our kidneys. Now, one other thing that also affects our kidneys greatly is eating too much salt. Not only salt, but anything that is related to salt or sodium. Either you take in the salt itself or tilapia that is salted. In Ghana, we call it kobe. There is something which is called stinking fish, momone, and all these things are high in sodium, and other Maggi cubes and some ingredients that are used in preparing food. The women can give me the right name. This preservative that is used in preparing food. Now, because they are highly concentrated in salt, when you take in a lot of these things, when it gets to your blood, it pushes everything to your kidneys. The kidney is supposed to filter water. So the moment there is a lot of sedimentation of sodium or salt, it destroys the kidney's nephrons. This is an assignment for everyone. Anybody who has colander, schema, or sonnier at home, when you are about to sleep, kindly pour some amount of salt in your colander or schema or sonnier. Then sprinkle small amount of water on a very small amount of water. Leave it and sleep over. By the time you wake up, you could see that there is some brownish discoloration in your schema or colander, which is a sign of rusting. And when you keep it for about a week, you will see that the salt will be boring holes in this colander. And that is exactly what the salt does to the kidneys. It destroys the kidneys' nephrons. That is why anybody who has kidney disease is restricted from eating salt. Anybody who eats a lot of salt gets hypertension. Anybody who eats a lot of salt damages his or her kidneys. So we should refrain from eating too much salt and other things that contains a lot of salt. Now, one other thing that also affects our kidneys is taking a lot of red meat. I repeat, taking a lot of red meat. During digestion, the food particles, especially meat, is processed and it is transformed into a semi-liquid substance. But after digestion, that happens in the duodenum, which is the small intestine. The byproduct of red meat turns into something powdery, powder form, and it is called uric acid, struvite, or other things, but I wouldn't want to go there. Now, this powdered substance, when it gets to the kidney finds it difficult to filter it. Just let's imagine that the kidney's nephrons, which is the schema or the colander, is responsible for filtering water. Then you have this powdered substance that has sedimented or cemented the surface of the colander or the schema, which is the nephrons and the glomeruli of the kidneys. What do you think will happen? It will make it difficult for the kidneys to filter the blood. And for that matter, in order for the kidney not to get a lot of pressure, it pushes all these byproducts, which is very powdery, to the joint, and it causes something which is called gout, accumulation of uric acid crystals around your joint. That is why anybody who eats a lot of red meat, anybody who consumes a lot of red meat has pains around the joint, either around your wrist, either around your shoulders, either around your knees, either around your toes, gout. One other thing that these uric acid crystals, which is the byproduct of red meat, also causes is amyloidosis. When we say amyloidosis, that is when these powdered substance sediment or cement the filtering portions of your kidney, so that instead of the kidneys to filter the blood, it wouldn't be able to filter the blood because these powdered substance have blocked all the holes, which is the schema or the colander, within which the blood should have passed through. So let's watch a video I did in my house just this evening to show something to you. I had a colander myself. Then I poured water in it so the water could drain through the colander nicely. And that is how the kidneys filters blood. Now, in order for you to understand the amyloidosis, I used a black polythene to cement the middle part of the colander, and I poured water in it. And let's watch what happened. Please excuse me. I'm just looking for this video to show you to come right away. Right away. Okay, 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 okay. Sub video. Sorry for wasting time, but I want to show you something. So,
Right.
Okay. I think I have it on this phone. I think I have it on this phone. Just coming. Okay, so let's watch this video. Please, can we see the video? Okay, so this is how the kidney filters blood. You see this? Okay, so let me go back. So this is how the kidney filters blood. So this is the colander or the schema I've been talking about. Now, when you take in a lot of meat, this is how the particles of the meat sediment or cement the filtering portion of the kidney. So if you could see, the water is retained in the colander without passing through any of the holes of the colander. So you could see there isn't any drainage of water. Okay, so as we all watched, you could see that when the black polythene was used to cement the colander, there wasn't any drainage of water through the colander, and that is exactly what happens to your kidneys when you're taking a lot of red meat. That is why when you're taking a lot of red meat, you could see you have a protruded stomach. In Tree, we would say sikafro, hey, this man has a lot of money. That is why he has a protruded stomach. Your kidneys are retaining a lot of water, and it has a lot of dirt, creatinine, uric acid, ammonia, phosphates, and other things. That is why your kidneys are getting swollen. So we should avoid from taking a lot of meat. Now, one other thing that also causes a lot of kidney disease is excess fat and cholesterol. Excess fat and cholesterol. When you take a lot of excess fat, palm oils, a lot of cholesterol-related food, such as eggs and other things, this is what it does. It clogs through your arteries and veins, and this prevents blood from flowing through your veins and arteries normally, like pipe that has a clog in it, that has a blockage. And this is how the cholesterol sediment clog in our veins. Can you see? Please, can we all see it? Please, yes, can we all see it? Yeah. So the yellow portion, the yellow portion is the cholesterol. Just look at the remaining portion that is left for blood to pass through. It is very minimal. That is why a lot of people who have high cholesterol are affected with cardiovascular diseases, heart diseases, kidney diseases. That is why when you go to the hospital and your blood pressure is very high, you are given some cholesterol medications like atorvastatin, simvastatin, and the like. And you'll be asked not to take in a lot of high cholesterol and fatty foods. So this is how cholesterol affects our bodies. Okay, one other thing that also affects our kidney is not drinking enough water. As I've already said, the kidney filters blood, and 80% of blood is water, which is called the plasma. So when you go to the hospital and you see somebody is on a blood transfusion, you could see that the uppermost part of the blood is very white, which is the plasma. Then the down part is the sediment portion of the blood. That is red blood cell, white blood cells, platelets, but you could see it is red. So if you drink a lot of water, it dilutes all these toxins so that the kidneys can function properly. So anybody who has a glass of water can have cheers with me whilst I sip my glass of water. That is just by the way. One other thing that also affects our kidneys is excess alcohol and smoking. Too much intake of alcohol and smoking. During this COVID era in 2020, a lot of us used sanitizers. And one thing you could realize is when you pour these hand sanitizers in your palms and you rub it, you could see that within a twinkle of an eye, it becomes dry. The sanitizer was made from alcohol. So when you take in a lot of alcohol, it mixes with your blood, and when it gets to the kidneys, it dehydrates the body. It makes sure that it dries up all the water within your blood. And anytime there is a dry up of water in your blood, you become weak. And that is what we call hangover. That is why anybody who drinks who drinks alcohol excessively and do not drink enough water, then the person becomes very weak and tipsy. And we say, hey, this person has been affected by hangover. It means that the alcohol has depleted all the plasma or the water component in your blood, and the kidney finds it difficult to filter the blood, because when the water component of the blood is taken away, it is left with the other component, which is the red blood cells, white blood cells, platelets, and other toxins and nutrients, and the kidney finds it difficult to do its work. So it is advisable to refrain from drinking a lot of alcohol, or if you drink alcohol, you need to drink a lot of water so that it can dilute the alcohol. What and how does smoking also affect our kidneys? There is something in smoke, either cigarette or marijuana, which is called nicotine. When this nicotine goes through your kidneys, it causes something which is called arteriosclerosis. Arteriosclerosis, hardening of the blood vessels. Under normal circumstances, the blood vessels are supposed to have an elastic nature, elasticity. It opens up so that blood can flow through. But the more you take a lot of fat, it causes arteriosclerosis. That is deposition of fat in your arteries. But when you take in smoke or cigarette or marijuana, it causes arteriosclerosis. So there are two different things. Arteriosclerosis is deposition of fat in your arteries. Then arteriosclerosis is hardening of the blood vessels. So it makes these arteries in your kidneys lose their elasticity. They become very hard. They lose their elasticity. And for that matter, most of these arteries in your kidneys can burst. And in doing so, they cause a lot of accumulation of blood and water in your kidneys, which causes edema and allow you to get a swollen body. One other thing that also affects our kidneys is too much intake of energy drinks and carbonated drinks. These energy drinks and carbonated drinks are high in soda. They are high in soda. Not only that, they're also high in caffeine. Not only that, they are also high in flavors, chemical flavors. That is why we have a lot of coloration of these energy drinks. When you take in a lot of energy drinks, because of their high in caffeine, high in soda, high in chemical flavors, when they get to your blood and the blood pushes everything to the kidneys for the kidneys to filter it, it makes it difficult. So the kidney works excessively, and this causes a lot of problems to your kidney, thereby damaging it. Another thing that also affects our kidneys is too much intake of dairy products. When we talk about dairy products, it consists of milk products, like any product that is sedimented with milk products. Now, the byproduct of milk, because milk is high in calcium and protein, the more you take in a lot of dairy product, that is milk products, the byproducts are also in a powdery form, like how I explained the red meat. So these byproducts causes powdered substance to be sedimented in your kidneys, which needs a lot of water to dilute it. So if you don't drink a lot of water, these powdered substance gets stuck in the holes of your kidneys filtrating point, which is the nephrons and glomerulus, and therefore it affects our kidneys. That is why I advise that even if you would take dairy product, we should make sure we don't take it excessively. Other than that, it will also affect our kidneys. One other thing that also affects our kidneys is too much intake of coffee. A lot of people who are in abroad, because of the nature of the work you do, you take in coffees a lot to make sure that you are stimulated and awake, and you could work for a very longer period of time. The more you take in a lot of coffee, you are harming your kidneys, in a sense that coffees are very high in concentration. So when it gets to the kidney is supposed to filter blood and not coffee. So too much intake of this coffee makes the kidneys suffer in filtering them, thereby destroying the kidney's filtrating point, which is the nephrons and glomerulus. And therefore, anybody who takes in a lot of milk product, which is dairy product, anybody who takes in a lot of coffee, anybody who takes in too much red meat, these byproducts clumps together and form something which is called renal stone or cholecystitis, cholelithiasis. So this is a picture of it, which mostly we call it kidney stones. So this is how the kidney stones looks like. Just look at this. Just look at this amount of stones. What amount of drugs can dissolve or melt these stones? Please, can we all see the picture I've projected?
Yes, please.
Yes. So if you have these stones in your kidneys, which are byproduct of dairy product, which are byproduct of red meat, which are byproduct of energy drinks and coffee, what amount of drugs can dissolve or melt these drugs? So the only solution for you is by surgical removal of the kidney. And as I've been saying time without number, if one of your kidney is taken off, even to get a donor, it is easy. So let's adhere to all these things we are all talking about so that we can have a healthy kidney. Yes, to continue, finally, the two remaining things that also affect our kidneys are not having enough sleep. You know, as we are awake and alive, every organ of the body works. So when we have enough sleep, the organs also rest a while. So we need to have enough sleep. I know we are all working for money, but at least when it's time for us to have enough sleep, we should do so. Then, overuse of painkillers. There are a lot of people who do self-medication, and I would advise that we all refrain from that. It is a very bad idea. Overuse of painkillers. When you take in a lot of painkillers like tramadol, like paracetamol, like codeine, like a lot of painkillers, it destroys your kidneys in this way. Anytime you take in any oral drug, there is something called first pass effect. The oral drug gets to your stomach, then after melting, everything is pushed to your liver for the liver to filter it, which is called first pass effect, metabolism of the drug. Then it pushes everything to your kidneys for your kidneys to filter everything. Then it takes the good part of it, the nutrient or the nutritional portion of it, or the chemical portion of it, so that it will get it to the actual part of the body that needs that particular drug. Then the chemicals which are used in producing this drug so that it can keep long and work will be excreted. Now, when you take in a lot of these painkillers, it causes something which is called interstitial nephritis. When we say interstitial nephritis, it basically means that these nephrons, which I said early on, that they are the filtrating point of the kidneys, they become swell or they become swollen. And if these holes in the colander I showed to you are swollen, what do you think will happen? It wouldn't be able to filter any water that is with the colander or the schema. So if the filtrating point, which is the glomerular and nephrons, are swollen as a result of the intake of excessive painkillers, most of these blood toxins will be deposited in our kidneys, and the kidney wouldn't release it for you to urinate. So you get a swollen feet, edematous feet, periorbital edema, and most of your bodies will be swollen. And finally, before I give the final thing that destroys our kidneys, as I said earlier, the kidney is a tube-bean-shaped organ. It has two tubes that is connected, and it is called ureters. So after it is done functioning, Let's look at it so that we can understand it very well. So this is the kidney. These two bean-shaped organs, and the two tubes I'm talking about are the ureters. Then after filtration, everything is deposited in our urinary bladder. Then when you feel the urge of urinating, it passes through your urethra. Then the ladies or the women, it passes through where your clitoris is, where you urinate, because where you urinate is different from where you menstruate. Then it comes out. Then for we, the men or the males, it passes through our penis. The urethra passes through our penis. Then you urinate. Anybody who has sexually transmitted infections like gonorrhea, like syphilis, like chlamydia, you are liable of having a kidney disease. Let the picture be on it so that you can understand me clearly. When you have this sexually transmitted infection or diseases, when it gets to your urethra, it can transfer itself to your urinary bladder and cause inflammation of your bladder, which is called cystitis. Then some of these organisms can pass through these two tubes that are connected to the kidneys, which is the ureters. Then it gets to your kidneys. Then they start harming the kidneys. And it also causes something which is called, let me show you a picture of what I'm about to mention so that you can. Polycystic kidney disease. This is how the polycystic kidney disease looks like as a result of infections caused by sexually transmitted infections like gonorrhea, like syphilis, like chlamydia, like human papilloma virus, and the likes. So it is advisable that anybody who has any infection, sexually transmitted infection, make sure you treat it very well before it affects your kidneys. So let's look at this picture. You could see a normal kidney on your left, then a polycystic kidney on your right. When we talk about polycystic kidney, it basically states that a fluid-filled sac with fluid, a fluid-filled sac around your kidneys or within your kidneys. And mostly these are results of infections caused by sexually transmitted infections like gonorrhea, syphilis, chlamydia, human papilloma virus, and the rest. So these are basically some of the things that causes kidney diseases. Now, let's look at the signs and symptoms of kidney diseases. When somebody has kidney disease, these are some of the signs and symptoms. The person will experience a lot of fatigue. The little thing the person does, he or she becomes very tired. Then when you urinate, you could see or you could have a lot of protein in your urine, which is called proteinuria, having a lot of accumulation of protein because the kidney is unable to filter these proteins, so it will excrete it directly. And mostly when you have a kidney function test, that is when you notice the proteinuria. Then you would also have polyuria. Polyuria is excessive urination. Excessive urination within a day, the person could be urinating a lot, and that is also a sign of having diabetes or high blood sugar. One can also have excessive headache. Fever can also set in. Nausea and vomiting can also set in. One can also have periorbital edema. The person will have a swollen face. One can also have ascites, accumulation of fluid in your peritoneal cavity. That is why when you see these people who have kidney disease, their bellies or their abdomens become swollen. That is the ascites, accumulation of fluid within your peritoneal cavity. In layman language, we would say that your stomach becomes swollen, but that is not the stomach, your peritoneum, the peritoneal cavity. One can also have dyspnea, difficulty in breathing. There is also fever, high body temperature. There is also fever. Then one can also have orthostatic hypotension. When we say orthostatic hypotension, you could realize that all the blood is shunted to your extremities, especially your ankles. You could see your ankles are swollen. So the blood is sedimented around your feet. And this is how these swollen feet that causes orthostatic hypotension looks like. This is how it looks like. This is how it looks like. So you could see that there are a lot of blood and water that is located around your ankle. So when you press it, it causes a pitting edema, So these are basically the signs and symptoms of kidney disease. And some of the kidney disease we have are kidney stones, as I showed you earlier on. We have nephrotic syndrome, when there is too much sedimentation of protein in your kidneys, it causes nephrotic syndrome. And the nephrotic syndrome is basically high protein in your kidneys that causes swelling, that causes too much sedimentation of fat and oil and cholesterol. Then we also have nephrosclerosis. Nephrosclerosis is basically when the tubes, the arteries and veins in your kidneys are very hard as a result of the intake of painkillers, cigarettes, marijuana, and other things. Then we also have pyelonephritis. That is a bilateral infection that affects your kidneys. Then we also have glomerulonephritis. The glomeruli and the nephrons are the filtrating point of the kidneys. So when you have glomerulonephritis, it basically means that your kidneys filtrating points or portions are inflamed. So basically, these are some of the things that affect our kidneys, and these are some of the signs and symptoms. Please forgive me for taking a lot of time whilst I was explaining. So if there is any question, without further ado, I would like to welcome any question that comes in our way.
All right, thank you very much, Doctor. I think it's a very good presentation, and we are well informed. I'll then open the platform for any questions. Anyone has a question?
Please try and forgive. I don't know much about I don't know much about the usage of Zoom. That is why I was finding it difficult to project some of these pictures for us to all see. So please forgive me for that.
Yeah. All right. Can you just show by hands? Okay. Japheth Andy. Yeah.
Yeah, Doctor, thank you for this wonderful presentation.
You're welcome, sir.
Okay. Please, does intake of red oil contribute to these kidney problems?
Yes, please, it does. As I said earlier on, oils are part of fat and cholesterol. So when you take in too much of it, it causes what I said to be termed as atherosclerosis. All these fat and oils will be deposited in your arteries and veins so that it will prevent blood from flowing through the arteries and veins normally. Let's notice something. The day you consume a lot of oil, you could see that the little thing you do, you become very tired. It means the blood is unable to pass through your veins and arteries normally. And for that matter, it is finding it difficult. So the heart is supposed to do a lot of pumping activity and actions. So even if we would take oil, it should be in moderation and not too many or too much.
Thank you very much, Doc. May God bless you.
Okay, thank you. I think I can Biggie or Biggles. Is it the name? Am I right? Biggles, yeah. All right.
Yes, please. Okay, please. I wanted to ask. He spoke a lot about the nephron and the glomerulus. So if someone is having either right or left kidney cyst, Is it the cause of the nephron or is it a different thing that occurs that way?
Please, the question again. The question isn't that clear.
Okay. Please, can you hear me now?
Yes, I can.
Yeah.
Okay. Please, I was saying that you spoke about the nephron and the glomerulus, whereby you said is the filtration point of the kidney. So
Yeah.
if someone is having either left or right kidney cyst, is it the cause of the blockage to the nephron or is something else that led to
Okay.
that?
All right. So this is how the nephrons are and the glomerulus. The nephron is like a tube. Okay, so let me use the cork of the pen. The nephron is like a tube that has a hole in it. Then the glomeruli are the tiny blood vessels that allows these blood together with water to flow through before it gets to the nephrons. So when these are damaged, it basically means the blood together with water can't pass through to get to the kidney itself. So anybody who has kidney cyst, is either the cyst is behind the kidney, on the surface of the kidney, or within the kidney, because a cyst is basically an accumulation of fluid around a portion of the body. So it's either the cyst, the accumulation of the fluid is on the surface of the kidney or within the kidney. As I showed a picture to you, so let's look at this picture so that you can clearly appreciate what I would want to explain to you. Okay, so looking at this picture, this is a polycystic kidney. So these fluid-filled sacs are on the surfaces of the kidneys, but you can also have a fluid-filled sac which is within your kidneys. And this can be caused by any of these things I mentioned earlier, or when you have infection, which is caused by gonorrhea, syphilis, chlamydia, and other types of infection. Please, are you clear with me now, respectfully?
Yes, please. Thank you very much.
All right.
Okay, Justina, I can see your hands up. I can see your hand up, sorry.
Okay. Thank you for the opportunity. Doctor, I would like to ask this question. Children, let's say my children, instead of them drinking water, they prefer the diluted one, you know, they always want their water sweet. So unless I add a diluted drink, or let's say, unless I mix water with a diluted drink, and I would like to know, is this one good to encourage, or I have to still entreat them to drink only water and not the diluted ones? Thank you.
What are some of the things you dilute the water with, if I may know?
They find it difficult to drink normal water, like the water we all know of. They want it a bit sweet. So we have a different kind of flavor, orange, blackcurrant, and I think I've forgotten the other one, that you have to mix water with it before you drink it.
Okay.
It's a drink though, but you mix water with it.
Okay, I get you. I would advise you let them start drinking normal water, because the more they take it, you know, too much of everything is bad. These diluters have flavors, and they are basically incorporated with a lot of either soda or chemicals, not to harm the body. Though, but the more we take it, or the more the children take it, it will get to a time they can't be taking normal water, because their system has a customized with this diluted water, and it will really affect them. So I would advise that you start taking them through the intake of normal water.
Children
So
should
that
take raw water, not diluted drink. It doesn't matter. That's what the kidney doctor is saying.
So that it will get to a time they can be drinking normal water instead of this diluted water, because this can be relatively proportional to using a drink as a substitute to water, which is very harmful. So I will advise you let them take normal water, as we all do, because anything flavor definitely has some soda and chemicals embedded within it.
All right. Thank you, Doctor. Any more questions? I think let me ask mine. I think
Okay.
from this whole discussion, I've really heard a lot about the things that we shouldn't, not that we shouldn't, but we should do it in moderation.
Good.
So I think the question is, how lot is this a lot that we are talking about, that so that we can put in perspective a quantifier measure, knowing that, okay, eat maybe 2 eggs in a week, and that will be okay. Or if you want to eat meat, eat this slice of meat in a month, so that we can put in perspective what this a lot means.
Okay, thank you very much for your question. Thank you so much for your question. You know, when we talk about a lot and not in a lot, or excess and not in excess, something like sugar, somebody would say, I wouldn't want to take sugar for a year. But the moment you take anything carbohydrate, you should bear in mind that anything carbohydrate, when it gets to the body, the byproduct turns into glucose. So you've taken sugar without knowing that you've taken sugar. Now, when you take in meat, we know meat is essential for building our bodies and the muscles, but we should take in moderation. Within a week, you can be alternating red meat with fish, because fish has a lot of omega-3 oil, and it's essential for the body, and its protein nature is quite less compared to red meat. So we should be moderating our intake of red meat. When we take in something like dairy products, you can take dairy products like twice in a week. And when we talk about taking in of egg intake should be recommended for kids from age 1 to 10 years, because they need egg to grow. So they can be taking egg every day. But as an adult, the more you take in a lot of egg, it increases your cholesterol level. So you can take in egg like 2 days in a week. Somebody will say, okay, if you say I should take in eggs twice in a week or 2 days in a week, why don't I fry like 6, 7 eggs together, then take it today? Then the following day, I will take like 5, 6 fried eggs or cooked egg together. My dear, you are doing more harm than good to yourself. So let's let our discretion direct us, so that whatever we take in, with the exception of water, that should be taken in excess. Anything we take, like fat and oils, like cholesterol-related things, like coffee, like energy drinks and other drinks, anything we can take, but we should make sure we quantify it. It should be in moderation. You could tell yourself that this week I've eaten a lot of eggs. You could tell yourself, so this week, okay, why don't I take egg for 2 days? Then the following days I wouldn't take egg. So in measurement, you should rather assess yourself that, no, I wouldn't be taking this particular thing for a longer period of time within the week or a month. But to give you an accurate measurement, like take 1 pound of meat, that wouldn't help, because even if I do so, you might have the edge in taking it. Oh, let me choose small meat. By the time you realize, you might have taken it in excess. So I don't know if you could understand me properly with this explanation.
Well. I think that's well noted. Thank you very much. Any other question?
Okay, I think I saw a message here, and I went to revisit it. The question is, please, is drinking too much water bad for the kidneys? No. Drinking too much water is rather good for the body, because the blood is a combination of water and other products. And I said earlier on that the plasma, which is the water portion of the blood, is about 80%. So the more you take in a lot of water, as I am doing, the more you help your kidneys to filter the blood very well, because there are some byproducts in your kidneys which are very harmful, like creatinine, like uric acid, like urea, like ammonium, like phosphate, like sodium, like struvite. So the more you take in a lot of water, it helps your kidneys for the blood to dilute all these byproducts so that the kidneys can eradicate it through your urine. I just saw a message here. Is drinking iced water bad for the kidneys? Drinking iced water is not only bad for the kidneys alone, but it's bad for the entire body. Why do I say so? The more you take in a lot of iced water, now, anytime you take in fatty foods, try and use cold water to wash your hand. You could see that the oil is stuck around your palms. So when you take in a lot of iced water, that is what happens in your stomach and in your kidneys. It makes sure that most of these blood vessels are freezed and most of these fat deposits are stuck in your kidneys without getting good filtering. So it really affects not only the kidneys, but the entire body. So we should drink iced water or chilled water in moderation so that it wouldn't affect not only our kidneys, but our heart and the entire body.
All right.
Okay,
Thank you.
I just saw a question. I think someone's hand is up. So when I'm done answering that question, then I read the message.
Read the message. Okay. So, Japhet.
Yes. Hello, yes, please. Doc, please, can
Yes,
I have the recorded version of today's presentation? And if possible, your telephone number.
Okay, I think Gisesina would do that. I saw a recording. I don't know much about the Zoom, so I don't know if this teaching is recorded, but I have a recorded version of kidney teaching. So after the lectures, you can just WhatsApp me on 0245 793191 so that I send you some of the kidney teachings for you to listen. Please, if I should repeat the number, 0245 793191. Yes, and you just send me hi with your name, then I'll send you some of the videos.
Thank you very much. May God bless you, Doctor.
So let me read this question. I was diagnosed diabetic last year and I'm on drugs now. It has dropped to 7.5. Is it going to affect my kidney? I mean, the drugs I'm taking. To be sincere with you, most of these drugs are chemical formulated. You know, that is how drugs are produced. The active ingredient is mixed with chemicals so that the lifespan of the drugs can be expanded. So the more you take these drugs, I don't know if it is metformin, if it is glimepiride, if it is glibenclamide, if it is galvusmet or insulin itself, I don't know the kind of drugs you are taking. So the more you take in a lot of these chemical-related drugs, most of these chemicals gets to the kidneys and they tend to affect the kidneys. So I would advise that you take in a lot of water, then try and be taking natural juice. If you don't have any problem with blended cucumber, blended orange, blended pineapple, blended pawpaw, blended watermelon, if your health provider haven't told you that you have any problem with it, you can be taking a blended portion of these things I've mentioned early on so that it can flush out all these toxins which are byproducts of these drugs you are taking. So let me check the next question. Please, how can the byproduct of the red meat and dairy products be flushed out of the kidneys? Yes. So you can be drinking a lot of water. That is why anybody who has kidney stones is advised to take in a lot of water so that they can dissolve some of these particles. So you can be drinking a lot of water. You drink a lot of water. You drink a lot of water. And most of these blended fruits I've talked about are also helpful, like cucumber, pineapple, apple itself, watermelon together. Well, watermelon together with the seed, they are very helpful in flushing out all these byproducts. I think Nanama's hand is up. So
Yes.
if that, okay.
Yes, so after Nanama, we will take 2 more questions, then
Okay.
we'll be done. After Nanama, we'll
All
take
right.
2 more questions.
All right.
Thank you very much, Doctor. This has been really, really insightful. I just want to say thank you so much. And my question is, if someone has been diagnosed with high cholesterol, from all that you've been saying, high cholesterol can lead to kidney problems as well.
Yeah.
Are there any things that this person can do to reduce the cholesterol that they've been diagnosed with as being high? Thank you.
Okay. All right. Before these high cholesterols can be lowered, the final resort is medication, which I would come to that finally, medication. But even before that, one, we should also reduce our fat and oils intake. Fat and oils intake, like red oil, like these oils that are available. We know we definitely prepare food with oil, so we should reduce how much we use oil in our foods. Then these dairy products, milk products, they have some element of oils in it. So if we can also desist from taking too much of them, it can also reduce our fat and oil and cholesterol intake. Then we should also avoid the intake of egg. We should also avoid the intake of egg. It's also high in cholesterol. So apart from all these things, if you don't have any problem with lemon, if you don't have any problem with lemon, early in the morning, you can just heat water. Let it not be that very hot, but warm water. Then you squeeze some lemon in this water. Then you drink it early in the morning. Then you exercise a little bit. This will help melt these fat and oils and cholesterol before you even get to the medication, which are atorvastatin, simvastatin, and all these statins that are given for people who have high cholesterol. So this is basically how you can go by anybody who has high cholesterol.
Thank you. I think there are 2 questions on the chat.
Okay.
One is, please, what about cucumber, lemon, and ginger?
Yes, it's also good. It is also good for the body. Ginger is a natural antioxidant. Anybody who takes in a lot of ginger, it's also an antibiotic. You wouldn't get a lot of cold. Lemon flushes your intestines so that microorganisms can be eradicated through your feces. And cucumber has vitamins, potassium, and it's also good for your kidneys and also dissolves and also eradicate all these byproducts of meat and dairy products that might have caused kidney stones. So they are all good, but you have to look up to yourself. Some people react to ginger, cucumber, and lemon, which causes ulcer in them. That is why I wouldn't want to talk much about it. But anybody who doesn't have such problem, you can be using it, and that will be good for you. And the last question is, please, those people who take slimming teas, are they good for the kidneys? Mostly, these slimming teas, some of them are natural in a sense that they are made from our natural elements like lemon, ginger, cinnamon, cloves, and the other things. So when they are in naturality, I don't think they have any problem. They harm the kidneys or they cause any problem to our kidneys. But if they are chemically formulated, that is when I would advise that you take them in moderation. Other than that, they would affect your kidneys.
All right. Thank you very much. Thank you very, very much for this insightful presentation. Will you take the last one? just the last one, and any other question that comes, we will not take it.
The question is, please, can the statins medicine affect the kidneys? This simvastatin and the trovastatin, they are made from the element of the drugs together with chemicals. For instance, let me say this so that you understand me. For instance, what should I even use? Like orange. Orange has something in it which is called diosmin. And the diosmin is used in preparing drugs for hemorrhoids, Amoako, hemorrhoids, or PAS. So anybody who takes in a lot of orange, after taking the orange, you take the fiber, the roughage in it, you didn't get PAS. Okay, so in order for them to get the diosmin in the orange, its longevity, they will add chemicals to it so that the orange, the diosmin that is gotten from the orange together with the chemicals will let the drug have a longer lifespan. So I advise that as you are taking these statins, you should also be moderating your intake of fats and oils and cholesterol so that a time may come, you wouldn't even take these drugs again, but you'll be free from the high cholesterol and the fats and oil, which are sediment in your capillaries, arteries, and veins.
All right. God bless you. God bless you, doctor, for such a wonderful thing. My takeaway for tonight is that just drink a lot of water. And
yes.
Oh, all right. when you said that, I think this presentation was really practical. When you said I quickly going to grab a water by my side and I started sucking.
That is good.
All right. Thank you. I'll leave the platform for Justina. Hello, Justina. You can take it up from here.
Yeah.
There you are.
Thank you, doctor. Thank you so very much for the insight you've given us today, for your time and everything. We truly appreciate it so very much. I wish you were my science teacher when I was in secondary school. I wouldn't have sat for the science again. You made science so simple this evening for me. Thank you so very much. And everybody, thank you to everybody who made it to today's program. And then I am hoping that we have more section with Doctor, because I think there is more in him that we have to tap. And if we have this opportunity, we have to take advantage of it. So thank you to everybody. And then the only announcement we have for you, everyone, this evening is those who access the food bank today. Tomorrow we are open, and then come in your numbers, and then everything will be there for you as it's done all the time. And that'll be it for now. And thank you so very much, everyone. Thank you.
Okay, so to also sign off, I would also like to thank everyone who also joined this feed. It isn't my doing, it's the Lord's doing. I always pray that we all have the opportunity to access such information. If most of us are stuck with this information, I think it would help us a lot. And to say it point blank, anytime I'm called, I am privileged and honored to come to your doorstep to deliver whatever it is embedded in me, because I wouldn't want to waste all these things in myself alone, but I would want everybody to enjoy what God has given to me, so that even if myself don't get something from it, somebody close to the other person can also have something that he or she will tap from me. So thank everyone who joined this feed today. I really appreciate. And all that I wish that this week should be a blessed week for all of us. Thank you. Thank you, thank you, thank you. Thanks to everybody.
Thank you, Doctor.
Thank you, Doctor, and God bless you.